Okay. Buenos días, vamos a dar inicio.
Good morning. We're going to begin today's webinar to celebrate World Hypertension Day, which is normally commemorated in May, but it was postponed to October 17th. Thank you all for being here and for being here on time.
We have a big screen and you're full of it.
I hope not.
You're the only one actually on the whole screen.
I would ask all of
Anyway,
the
great to see you. You look
to,
great. You look good.
To turn on their videos.
Yeah. Very nice to see you online.
Okay, so we are live. We can start this meeting now. Go ahead.
Yes, thank you everyone for joining us for World Hypertension Day. As you've just heard, we've been joined by Dr. Tedros, and I will hand over the floor to him to make the opening remarks. Today we'll be celebrating achievements in hypertension control and management, and I'd like to welcome all 438 participants and many hundreds more that have joined us streaming on our social media accounts through PAHO and WHO. Dr. Tedros, over to you.
Thank you. Thank you, Jamie. Dr. Tom Frieden, Chief Executive Officer of Resolve to Save Lives. Dr. Xinhua Zhang, President of the World Hypertension League. Dr. Marcie Tomaszewski, President of the International Society of Hypertension. And my friend Didier Drogba, dear colleagues and friends, I hope Didier is with us. Good morning, good afternoon, and good evening to everyone, and thank you for joining us today for World Hypertension Day. Today has a personal resonance for me because I am one of the 1.1 billion globally living with hypertension. I have access to good medical care, but many others who live with hypertension are not as lucky as me. Hypertension is one of the world's silent killers, but it does not have to be. It's within our reach to prevent, diagnose, and treat. In the face of the COVID-19 pandemic, action on hypertension is more important than ever. People with hypertension are at increased risk of severe disease and death from COVID-19. As you know, in Italy, 68% of patients who died in hospital with COVID-19 had hypertension. Like COVID-19, the hypertension epidemic is hitting the world's most vulnerable the hardest. 9 out of 10 people with hypertension don't have it under control. And 2 in 5 people with hypertension are not aware they have it. So more than 1 billion people, what Tom Frieden calls them walking bombs, because the proportion, the managed proportion is very small. Too many people die too young from cardiovascular disease because of delayed, incomplete, or interrupted treatment of high blood pressure. At the same time, we're seeing a rise in behavioral risk factors, such as physical inactivity, diets high in salt, fat, and sugar, and harmful use of alcohol. To support countries to take action against cardiovascular disease, WHO developed the HEARTS package with support from partners at the US CDC, Resolve to Save Lives and others, which outlines the 6 key ingredients for addressing threats to heart health, including hypertension. We know that HEARTS package works. Today, we can celebrate the fact that 3 million people in 18 countries where the WHO Heart's technical package has been implemented are better protected from heart disease. But we must not let progress falter. The COVID-19 pandemic has disrupted essential health services for hypertension in over half of the world's countries. Investment in hypertension management is more urgent than ever. To help build momentum, today, WHO and our regional office for the Americas, PAHO, AMRO, are launching a virtual course on accurate blood pressure measurement. PAHO AMRO is already making significant strides in hypertension control with its Hearts in the Americas program. The COVID-19 pandemic is reminding us that life is fragile and health is the most precious commodity on earth. That's why action on hypertension is more important than ever. Working together, we can help everybody live longer, healthier lives. It's within our reach. I thank you.
And many thanks to you, Dr. Tedros, for joining on this occasion. We're celebrating over 3 million lives saved from hypertension management and control. And next, I'd like to welcome Dr. Tom Frieden. He is the president and CEO of Resolve to Save Lives, an initiative of Vital Strategies. Thank you, Dr. Tom Frieden, for joining us today.
Thank you very much. And Dr. Tedros, it's wonderful to share the floor with you and also to both be patients with hypertension on treatment and therefore preventing heart attack and stroke and other complications. This number is mind-boggling. 11 million people, or close to 11 million people per year, killed by a condition that we know how to prevent and we know how to treat. I'd ask you to think about 4 M's: medications, monitors, money, and monitoring. And to get hypertension under control, we're going to need medications with simple regimens. And we thank WHO for approving the inclusion of fixed dose combination drugs onto the essential medicines list last year. This is a big step forward. Simple protocols, really simple, 3 steps, 4 steps, 2 steps, where we can get to titrate medications up will be enormously important. Monitors, digital monitors that are accurate and affordable will be extremely important. Money, funding by governments, and also all fees for patients being eliminated will be very important. It's not enough to diagnose patients. We have to treat them right and treat patients in a way that is supportive so that they'll continue the medications. And monitoring, rigorous monitoring, so we can know how we are doing. These 4 M's are going to be essential to control hypertension. I think we have some slides. Do you want me to project them or do you want to do that? And buenos días para todos en PAHO en las Américas.
And good morning to everyone to PAHO in the Americas and in the US.
Spanish-speaking world. Shall I share screen or do you want to do it?
Go ahead, please share the screen.
I should do it?
Sure.
Okay, there we go. So hypertension is not just extremely important in and of itself. It is the single most important thing we can do with healthcare. It's also a pathfinder for universal health coverage. Now, when does 50 plus 30 plus 0 equal 100? If we can increase blood pressure control from 10 or 15% now to 50%, reduce sodium intake by 30%, and eliminate artificial trans fat, and thanks also to WHO for calling for the global elimination of trans fat, Dr. Tedros, we can save collectively 100 million lives over 30 years. Hypertension not only is the leading risk factor for preventable deaths worldwide, it kills more people than all infectious diseases combined. And every 20 millimeter increase in blood pressure doubles vascular mortality in younger adults. We looked at this years ago. Blood pressure control can save more lives than any other primary care intervention. It's the single most important thing healthcare can do for adults. Primary healthcare is the most needed but most neglected part of the healthcare system. Providing effective hypertension treatment services both requires and facilitates the establishment of effective primary healthcare systems. Universal health coverage needs to be more than just a slogan. The accumulated knowledge from dozens of countries has identified these three big hurdles to blood pressure control: diagnosis, treatment, and continuity of care. And if we're going to make progress, we have to address each of them, making screening routine, addressing primary care attendance, improving measurements, using simple protocols, addressing drug shortages and therapeutic inertia in the private sector, including reminders and recall systems and affordable or free medications and care, and improving treatment systems. These 5 components are essential: a simple protocol, regular supply of quality medicine and equipment, team-based care. Dr. Tedros, the work that you did in Ethiopia with community health extension workers shows the way for how we can get massive treatment done. Patient-centered services, and perhaps most importantly, an information system so we know how we're doing and can continuously improve outcomes. We're releasing today at Resolve a 6-step guide for program managers for national, subnational programs and health systems, resources and practical tools at each step at linkscommunity.org. We're delighted to have people from 100 countries in Links Community, free, open source, being clear about establishing the administrative structure, setting treatment protocols, ensuring medicine supply, training workers, implementing information systems, and then get going with treating patients and continuously improving outcomes. The report WHO is launching today is extremely important, and it shows that there's great variability. There's some excellent programs out there, but we all need to improve continuously. I'll just tell you in closing that in the United States, we tried very hard in a program called Million Hearts. A lot of the government worked together on this, and I'll be very frank, we failed. We went from 54% community-wide control of blood pressure to 44% over several years because we weren't able to keep up with increasing obesity, with decreasing quality of care. It comes down to simple protocols, patient-friendly, and addressing financial incentives. You have to make sure that for the healthcare system, they're focused on hypertension control, and for patients, you are eliminating any and all barriers to adherence. Because let's think about people living with hypertension, 1.1 billion, 1.4 billion, depending on how you count it, around the world. Today, they have no symptoms of their high blood pressure. They have many other problems, and they must take a medication for many years, for life in all likelihood. And it's going to cost them time and money to do that, and they may feel that they have some adverse effects. It's not a natural or normal thing to do. It can only be done if we have a effective health system that supports patients, puts patients at the center, and holds providers and systems accountable for the single most important outcome in adult health. So I call on all of us to redouble our efforts, and I congratulate the communities, the patients, and the healthcare workers all over the world who are really making great progress on this. Thank you so much, and thank you, Dr. Tedros, for your leadership and for WHO's partnership.
Many thanks, Dr. Frieden. And next we have joining us the president of the World Hypertension League, Xinhua Zhang. I will hand the floor over to you for your presentation. Thank you to all of our partners for joining us today. It's an honor to be with you. And we have thousands who have joined us both online and in the room now. Again, a reminder that this is being simultaneously translated into both English and Spanish. And both rooms, if you click on the settings, you can hear those translations. And over to you.
Dear Dr. Tedros, colleagues and friends globally, good morning, good evening. It is my great pleasure to join the 2020 World Hypertension Day event on behalf of World Hypertension League. We all know that increased blood pressure is the #1 reversible cause of death and disability globally. Every year, more than 10 million people die from hypertension-related complications and leave more people with disability. During the COVID-19 pandemic, more hypertensive patients experience severe condition and a high case fatality rate than non-hypertensive patients when infected. Plenty of evidence indicate that the control of hypertension could save millions of lives. it could save more during the COVID-19 pandemic. However, among more than 1 billion of hypertensive patients globally, most of them either not know it or not control it. The theme of World Hypertension Day 2020 program promotes blood pressure measurement for all adults in all clinical settings and by public screening programs. We emphasize the accurate measurement with validated devices and correct methods. Accurate reading is the first step of proper diagnosis, then treat the right patients for saving more lives. Unfortunately, many detected patients are not treated or not controlled. Thus, we encourage all healthcare settings to measure blood pressure for all visitors and control blood pressure for those untreated or uncontrolled. To make the effort sustainable and scalable for detecting, treatment, and control of hypertension for population, we need police regulations, human resources, and funding support for all levels of governments to ensure the supply of medicine, the device, the training, and the monitor to empower primary care services play the major role. If the mechanism works for hypertension control, it will work for other chronic conditions and eventually work towards the universal health coverage. It is grateful that WHO coordinated the development and the implementation of HART technical package. The HART package provides the guidance for policymakers, the healthcare system, the trainers, and the monitoring system to help primary care settings take the role of prevention and control of CVD and other clinical conditions. World Hypertension League is pleased to work with WHO and partners and our member organizations globally to implement HART package. Now we have the great pleasure to celebrate the success of WHO, help the 3 million of patients. With the support from Resolve to Save Lives, the WHO country office in China and WHL leads the HART China Hypertension Control Project since 2017. The project currently covers 100 million of population in Henan province. With the support from the leadership of provincial government, the project has been technically assisted by WHO China country office and operationally led by WHL and the local partners. The 6 elements of HART package are fully applied: police support for operation, standard protocol on interrupted drug supply and the device, training sessions for measurement, diagnosis, treatment, and lifestyle consultation, advanced measurement and monitoring system. 24 hours, 7-day online technical support has been deployed in 106 counties and 1,200 primary care settings. The opportunistic screening becomes a daily practice for primary care. Up to now, there are more than 300,000 of adults measured blood pressure, more than 100,000 hypertensive patients registered, and the treatment and control rate improved continuously. We are so pleased to see the implementation of HART package is fully consistent with the theme of World Hypertension Day 2020, and we thanks to the World Hypertension League and the World Health Organization and all our partners to work together to control hypertension globally. Thank you.
And many thanks to you for joining us today. Some of these statistics, as we mentioned, are very shocking, and many people who have hypertension, as we've heard, don't know that they have it. So hopefully we can get the HART's package and implementation into more countries. And next, joining us, who will be giving a message from the International Society of Hypertension, is Dr. Makij Tomaszewski. Welcome, and thank you for joining us.
Please unmute yourself. Okay, now we can hear you.
Good afternoon, good morning, Dr. Tedros, friends, colleagues, and collaborators around the world. My name is Makij Tomaszewski. I'm the president of International Society of Hypertension. And on behalf of the Executive Committee and the Council, I would like to thank our partners at the WHO, at WHL, Resolve to Save Lives, and PAHO for inviting us to celebrate World Hypertension Day together. At the time when the world battles with COVID-19 pandemic, it's very easy to forget about the burden of non-communicable disease and risk factors, such as hypertension, and the effect they have on people's life around the globe. Hypertension is the single most important cause of disability and premature death around the world, because its awareness, its detection, management remains suboptimal despite all our efforts. International Society of Hypertension remains fully committed to its mission to reduce the global burden of hypertension around the globe through education, through international collaboration, and through outreach. We are very proud to have supported the HEART's technical package, and we are absolutely delighted to see the positive impact it has already had in saving people's lives around the world. We fully support our colleagues and friends and WHL in their 2020 key message, measure your blood pressure and live, control it and live longer. We very much hope that our own initiatives, including the Global Hypertension Guidelines and the contribution of May Measurement Months to raise awareness of high blood pressure around the world, will help in the battle we have to fight against the global burden of hypertension. Today, the International Society of Hypertension celebrates with our partners, our colleagues and friends, the very important World Hypertension Day. And we are delighted to join you today through this meeting. Thank you very much.
And thank you. That was a very nice message from the president of the International Society of Hypertension. Thank you for joining us. We'll now go to some learning from the field. We have Dr. Anselm Hennis with us to discuss Hearts in the Americas. He is the Regional NCD Director at the Pan American Health Organization. We're very pleased to have you with us today. Over to you, Anselm.
Thank you so much. Good day, Dr. Tedros, colleagues, friends. World Hypertension Day is a time to remind ourselves of the importance of blood pressure control for health and well-being. The Americas region, like other regions, struggles with hypertension as a significant public health problem. In the Americas, elevated blood pressure is the principal modifiable risk factor for cardiovascular diseases, the leading cause of death and disability, which account for almost a third of mortality in this region annually. However, still we note that only 2 in 10 persons who have hypertension are controlled. The Global Hypertension Treatment and Control Initiative actually began in our region with the Million Hearts program in the United States of America, led by the CDC, and you heard Dr. Frieden's comments earlier. And this triggered a pilot project in Barbados in July 2014, supported by the Centers for Disease Prevention and Control, PAHO WHO, national stakeholders, and the government. This project successfully demonstrated that standardized hypertension treatment approaches could indeed improve blood pressure control. The Hearts in the Americas initiative, aimed at strengthening the management of cardiovascular diseases in primary health care, began in earnest in the region of the Americas in 2016 in Barbados, Colombia, Chile, and Cuba. 8 other countries are now participating in this program, namely Ecuador, Argentina, Panama, St. Lucia, Peru, the Dominican Republic, Mexico, and you will shortly hear about the experiences in Trinidad and Tobago. The initiative is now active in more than 370 primary care facilities, covering a patient population of more than 7 million. So what have we learned? The Hearts in the Americas program results in improved blood pressure treatment coverage, as well as hypertension control in the primary care setting. This is based on low-cost interventions and system changes, such as establishing a multidisciplinary care team, standardized protocols, use of a core list of antihypertensive medications, training primary care providers, and establishing an information system that allows for patient monitoring and follow-up. As such, it is a successful model for improved NCD management at the first level of care. Political engagement and buy-in are key to successful implementation. Leadership by and engagement of ministries of health with the participation of local stakeholders are critical ingredients for sustainability. There must be ownership and investment by the health system such that the Global Hearts Initiative is not seen to be a competing vertical project working in parallel to the existing healthcare system, but rather it must be institutionalized within the primary healthcare system with seamless integration into existing health services. Health system transformation to address NCDs remains a challenge, but is at the core of achieving universal health coverage. To achieve its maximal impact, Hearts in the Americas initiative must not only improve blood pressure control through treatment approaches, including the fixed dose combination pill, but must also strengthen health promotion and lifestyle change, including reduction of dietary salt intake, elimination of trans fats, tobacco cessation, and increased physical activity. It has been difficult for countries to achieve national scale-up, and this process will take time, but is central to the ultimate success of this initiative. There's tremendous opportunity for innovation to strengthen information systems, training of healthcare professionals, and standardization of blood pressure measurement devices. Disruptions in health services due to COVID-19 may also be an opportunity for scaling up digital health applications and novel ways to provide medications. As public health systems throughout the Americas continue to combat COVID-19, PAHO WHO stands ready to assist with maintaining essential services for NCDs, including implementing the Hearts Initiative for improved hypertension control. I thank you.
And many thanks to you, Anselm. We'll next go to Dr. Rohit Doon. He will be speaking on implementing the Hearts package for hypertension control in Trinidad and Tobago. And he is the advisor of health promotion and public health at the Ministry of Health. Thank you for joining us, Dr. Rohit, and over to you.
Thank you very much, and a pleasant morning and evening to all. When the Global Hearts Initiative first appeared on our radar in Trinidad and Tobago without warning or ceremony, I was initially disposed to think that this was an act of serendipity. But later on, after closer reflection on the magnitude of this initiative, I now believe it has much more to do with divine intervention. Trinidad and Tobago is a twin island republic with a population of 1.3 million, of whom 1 million are adults, being served by a network of 105 health centers strategically located through the country, and with the prevalence of hypertension being between 28 and 30%. Our journey to become a Hearts participating country started over 3 years ago and is underlined by 3 major events. In May 2017, we launched our National Strategic Plan for Prevention and Control of NCDs, in which strengthening primary healthcare was identified as a major priority, propelling us towards refreshing and bolstering a sustainable, comprehensive, and integrated primary healthcare-based surveillance network. Hence, a national symposium on primary healthcare was conducted in May 2018, during which Golia Heraldo from PAHO Glad Tidings introduced us to the Global Hearts concepts and modules, and also invited our country to join the initiative. Within 2 days or 2 days later, the Minister of Health approved our entry into the Hearts, and 6 weeks later, Trinidad and Tobago became an official member of the global effort, culminating in the launch of the Hearts Initiative in July 2019. The progress from concept in 2018 to launch 1 year later in July 2019 was facilitated by the following crucial strategic actions. Firstly, and perhaps most importantly, was the establishment of a governance mechanism which was so organized as to enable the executive of the Ministry of Health through its National NCD Oversight Committee to direct, coordinate, and facilitate the functioning of the National Hearts Oversight Committee, who was responsible for the Hearts implementation strategy at the health centers level. A key feature of this layered structure was a common presence of selected membership in both and inclusive of the chairs in both of the Oversight NCD Committee and Hearts Committee. This enabled very timely decision-making and execution. There were other major milestones which had to be completed, including one, health centers assessment selection, preparation of a Hearts implementation plan, and a visit by the Hearts in the Americas team to Trinidad in November 2018, during which a master's training workshop on the application of the Heart modules were complete. And this was extremely important because it started to begin developing and bolstering our capacity to deal with Hearts and the education. The strategy to approve, adapt, and adopt the recommendation of the Hearts treatment module facilitated the development of a new national fixed-dose combination protocol and algorithm. And finally, to secure funding from the Ministry of Health general budget, and we are also able to secure additional funding through a dedicated NCD Inter-American Developmental Bank loan. Finally, to commence Hearts implementation in 2019, what's our current status? Implementation began in 5 health centers linked to community support groups representing a population of 150,000. Scale-up stands at 31 health centers with 415,000, and today it's at health centers representing 450,000. We expect that complete and universal application of Hearts will be completed within the next 12 to 18 months in 105 health centers. We have trained approximately 300 health center staff. Within the context of COVID-19, the best application of telemedicine find the biggest resonance in curbside pickup of hypertension drugs, which had tremendous impact on adherence to the medicines. We've begun the electronic registration of our creation of our registries, while at the same time utilizing our paper-based. NCD management has been added to the HIV program. The national hypertensive medicine coverage is at 50% of all patients in the country through a pharmaceutical assistance program, with hypertension medicines being provided at over 200 private pharmacies at no cost. Control at our largest health facility, over 60,000 population, moved from a baseline of 30% to 50% over a 6-month period, with all patients being treated with the FDCs. What were the lessons learned? One, a governance mechanism is extremely important, and you've heard me talk about such government mechanism. Political commitment also very essential, and this was demonstrated by our Minister of Health with timely approvals, early engagement, and budgetary support. Leadership at every level with rapid decision-making and implementation and monitoring and evaluation. Inclusiveness adopted in an all of government and all of society approach with multiple partners, including academia, civil society, private sector. The importance of a National Hearts Oversight Committee is absolutely necessary for success, and close collaboration between primary, secondary care, and academia in the development of our new national hypertension protocols. Finally, the role of PAHO is indispensable to us in Trinidad. It provided excellent support in steering, training, and seed funding. And I will finish by adding 2 more, I think, comments. I would like to emphasize the need for affordable access and availability to the new WHO-approved essential hypertension medicines, which we have adopted in our national protocols. We urge that PAHO begin to make these FDCs available through its strategic fund, which is a super key success factor. Secondly, I am convinced that this new Global Hearts initiative is a universal good and has the promise of and the potential to become one of the most impactful public health interventions of our time. Finally, in closing, I'd like to share with you an old Trinidadian adage which speaks to health and happiness. I quote, "You may be old in your face, but you should be young in your waist." Thank you all very much.
And thank you very much for joining us today and for sharing those inspiring words. Certainly, we'd like to congratulate you on your achievements as well in Trinidad and Tobago. And I'd like to hand it over to our colleague next, Dr. Cherian Varghese, who's online with us, who will speak on improving hypertension control in 3 million people. He is WHO's cross-cutting lead on non-communicable diseases and special initiatives. Dr. Cherian, over to you.
Thank you, Jamie. Good morning, good afternoon, and good evening, friends and colleagues and partners. Every World Health Day, people always talk about big burden of conditions, all the problems, but this is different. Today, we will talk about solutions of how to address the biggest health problem in the world. This was published today morning in The Lancet, and over a period of 30 years, you can see the first line has changed to high systolic blood pressure. So this is the single most important leading risk to life and death, with a percentage of dialysis almost up to 10%. So second is smoking, and this has changed substantially over the last 20-30 years. You could see the previous graph, high systolic blood pressure was 7th, and now it is number 1. And again, just to sort of put it in graphics, in a country with a 20% prevalence of blood pressure, imagine if there are 21 million people with blood pressure, only about 3 million are under control. So that means we really need to bridge the gap in service delivery through technical packages like HEARTS, knowledge and capacity building like PAHO's virtual course, and monitoring with very simple measures, including the Resolve developed simple app, which is an example of the innovation. So for people to know that the Global Hearts Initiative also looks at the risk factors like tobacco, physical inactivity, sodium, and trans fats. And it has got a package called HEARTS, which is the primary care package. So the HEARTS package has got the elements and the modules associated with that. We also have included diabetes into that because diabetes is one of the biggest risk factors for cardiovascular mortality. So the WHO HEARTS is a very comprehensive set of interventions for addressing cardiovascular diseases, including hypertension and diabetes. So the journey we started with when Tom Frieden was the CDC director in 2016. We started that, and then we developed the technical package. When he moved to Resolve to Save Lives, we had an MOU and worked in about 6 or 7 countries. And in addition, the PAHO countries came in. So today, I am very pleased to say that we have come up with this publication of improving control in 3 million people, country experiences of program development and implementation, which you can access on our website. It is presented very graphically in terms of what has happened in all these countries, starting from how the program was launched. And thank you for the previous presenter of the importance of the national oversight, the importance of consensus protocol, service delivery model, access to medicines technology, sustained capacity building, simple monitoring, and finally showing that people on treatment are improving. So in summary, out of the 3 million people, as I said, government-led programs were there in all countries. So that is a very critical step. WHO heart-based protocols were developed. Models varied from primary care and in some places extended to community-based detection programs. Almost 380 million hypertension tablets and about 5,000 BP devices were procured in addition to government supplies and through partners. About 20,000 health providers were trained, and given the situation with COVID and also with the arrival of virtual programs, many thousands more are being trained. Monitoring is an area that still needs more work because in many places it is paper-based, in some it is electronic, and mostly it is hybrid. Because to get a cohort monitoring of hypertension control, we need preferably electronic monitoring systems. The number of health facilities offering a comprehensive hypertension management is increasing rapidly, and currently the number of people enrolled into protocol-based treatments stands above 3 million. And the improvement in hypertension control range from 2% to 37% across the countries. So what were the game changers? A national oversight committee and the government ownership, a simple and easy to follow protocol, and a mechanism to ensure that people who are put on treatment are, we know that what is their status and what is their control so that we can improve it continuously. So I just want to close by the quote from Nelson Mandela, who said that it always seems impossible until it is done. Hypertension control was always given as the rule of halves, that it is not possible. But I think we are beginning to change the rule of halves and say that more people can be detected, more people can be treated, and more people can be controlled. Thank you very much.
And many thanks to you, Cherian. That was Cherian Varghese, who is WHO's team lead in cross-cutting initiatives for non-communicable diseases and special initiatives. Thank you for joining us. Next, I'd like to welcome Didier Drogba, the president of the Didier Drogba Foundation. And he's joining us to speak on the foundation's experience of measuring hypertension in Côte d'Ivoire. Didier, welcome and thank you for joining us. Over to you to give some brief remarks.
Good afternoon, everyone. Sorry for being late, actually, but I'm really happy to join you guys and to speak about the program we've launched. So let me give you a brief story about how we come up to this point. I built a clinic in Ivory Coast, in Côte d'Ivoire, in Abidjan, but the main goal was to build 5 clinics around the country. But we started with this one, and we noticed that I think we can have a better impact using a mobile clinic, going to the people. So you're getting close to the people. Instead of them coming to you, you allow them to get access to healthcare. So with this mobile clinic, we did 8 suburbs in Abidjan in 2018. And then we went to the countryside where we did 6 big cities. I wish I could send you the document so you could see the numbers. Jamie, I don't know how can we do that, so I can send you all the documents and speak about it. But the main realizations are in Abidjan, we screened over 7,000 people within 2 weeks. Within 2 weeks, we screened 7,000 people who were diagnosed with hypertension, and there's different levels. And in the rural areas, we screened 9,000 people. So this is between 2016 and 2020. So the goal is to duplicate and to create more awareness around the subject, because obviously not many people know that this is one of the #1 killer in Africa. But we are trying to improve our communication with a communication department which is really involved into this. And also I'm really happy and proud to be part of the WHO family now, and to exchange ideas about how more efficient can we be here in Côte d'Ivoire. And thank you again for this opportunity that is given to the Didier Drogba Foundation to contribute to the healthcare condition of the population here in Côte d'Ivoire specifically, but generally in Africa, because we are looking forward to extend.
And thank you, many thanks for joining us today. And I would like to give you regards from Dr. Tedros, who had to leave to attend another meeting. He says hello and congratulations on your work.
Thank you. Send him my regards back, please.
And we're very pleased to hear of these achievements and sharing the experiences of how hypertension can be controlled, and the experience from Côte d'Ivoire especially, and the achievement of measuring hypertension and ensuring that it's controlled within thousands of people in just a matter of weeks. Thank you for joining us, Didier. It's a pleasure to speak with you.
Thank you, Jenny. I just want to add something. You know, the difficulty we encounter is to work with the local administration, you know, because the message are not really, I mean, it's not the main message that these administrations wants to spread. So once again, I would like to emphasize on this, and maybe local radios can be another channel to spread messages and awareness, to create a good awareness about the subject, because I think it's something really, really important to address.
Absolutely. And as you mentioned, awareness is very important because many people perhaps don't know the risk of hypertension. Thank you again for joining us. It's been a pleasure.
Pleasure. Thank you.
Today. And I'd like to hand over next to the India Hypertension Control Initiative, Dr. Kunwa, if you're online, Dr. Kunwa Abhishek from WHO India, and he's going to tell us about the India Hypertension Control Initiative. And for those of you just joining, a reminder that we are streaming across social media channels of WHO and PAHO, as well as on YouTube, Twitter, and Instagram. And there is simultaneous translation in Spanish. Thank you for joining, and over to you, Dr. Kunwa Abhishek from WHO India.
Thank you very much, and good morning and good evening to everyone. So start with the India Hypertension Control Initiative program. Is a multi-partner initiative by the Government of India, Ministry of Health, Indian Council of Medical Research, WHO, WHO India, state governments, and Resolve to Save Lives. And this program aims to strengthen the hypertension treatment component of the National Non-Communicable Diseases Program. And this was launched in November 2017. And initially the program was started in 5 states of these green states, which are here in the map, and scaled up to the more states which are in the yellow color, and plan to scale up in across the country by the next end of the year. So presently, the India Hypertension Control Initiative is being implemented in 53 districts from 11 states, and more than 2,200 health facilities from different level, district level to the village level health facilities are implementing India Hypertension Control Initiative. And more than 15,000 healthcare providers has been trained for the program, and this includes medical officers, staff nurses, pharmacists, and community health workers. And as of now, till September 2020, around 900,000 patients has been enrolled in this project, and they are put on treatment. But if you see this, there was a consistent enrollment was being done since last 6 months. Due to COVID, we can see that there is the decline in the registration. So the ISCI is based on the WHO HARS technical package, and the initiative also supports the adoption of and implementation of the standard simplified treatment protocol. And if you see here the picture of the Madhya Pradesh, one of the state, they have developed the hypertension treatment protocol, and all these states have developed their hypertension treatment protocol through the consensus and expert views. And through this hypertension treatment protocol, this is very easy to standardize the procurement of drugs, and it has strengthened the uninterrupted supply of drugs by providing technical support on forecasting, procurement, and distribution of the protocol drugs. And to support from the ISCI is also ensure the continuity of the adequate supply of drugs throughout the year, and that is evident in this graph that all the 3 classes of drugs has been available for throughout the year, and this is due to the initiative. The detection, treatment, and the follow-up has been strengthened by the team-based care through this program and task sharing and shifting. And also to mention that patient-centered services through decentralization services to the village level has improved the blood pressure control rate. And if you see this, it is seen in this graph in one of the state of Telangana, where the community-based ISCI services was initiated. The control rate, blood pressure control has improved from 57% to more than 60%. So this is very important, the decentralization of the care at the health at the community level. So this is how the monitoring is being done. So through efficient cohort monitoring systems, the ISCI, we generate monthly, quarterly, and annual cohort reports, and which is shared by the key stakeholders and reviewed in the district and state level meetings for timely and corrective actions. And one of the initiative for this ISCI program has been the launch and implementation of the digital simple app through, and the Resolve has been very important partner for developing this tool, and which has been very useful for the real-time monitoring of the project. And all these strategies which I have mentioned has contributed to the improvement of the blood pressure control rate, and which is evident if you see in the Punjab graph. When we started the program, the control rate was around 26%, and now the control rate has, the blood pressure control rate has gone to the 50%. So this is the key in monitoring system which ISCI has developed. What are the key lessons we learned from the program? The most and the first and foremost is the drug supply, uninterrupted drug supply till all the health facilities. And through this program, we are streamlining the process of the drug supply, where we are implementing diagnosis. So the blood pressure is screening at the health facility level and streamlining the process of the patient flow. These are the very key things. And then transfer of patients from the higher health facilities to the lower health facilities. So these are the key things which the program has been efficiently working on. And staffing is the very key. And through the availability of where there is a challenge across the country, the staffing has been a challenge, and the NCD and availability of the dedicated NCD staff is key for the program, and program managers at the state levels and the district level is very essential. But I would like to mention here, through WHO India has provided the project staff in the form of cardiovascular health officers and the non-medical treatment supervisors, senior treatment supervisors, which have been very instrumental in the supporting the program at the district and the state level. Decentralization of service delivery, as I mentioned earlier, the program data has shown that village level service delivery helps in increase the treatment adherence and increases the blood pressure control rate. And the data for continuous improvement, the simple app has been the very instrumental in the real-time data entry and the data monitoring and the review meetings, and the dissemination of the data at the appropriate time has been very useful in the program improvement. So and there are two more things that one is the program governance mechanism, which the country has at the highest level. It is being monitored from the highest level at the national level, and the budgetary allocation. So now the government of India has started the budgetary allocation for the India Hypertension Control Initiative, and all the drugs are being provided are the free of the cost. So all these strategies and lessons learned are being used for improving the quality for expansion of the initiative to the rest of the country. So I will end by thanking. I would like to thank and acknowledge the support of all the ISCI partners, Government of India, Indian Council of Medical Research, state governments, WHO India colleagues, and Resolve to Save Lives for the implementation of this this initiative. And we will keep on improving and with regard to the blood pressure control rate. Thank you, and over from my side.
Many thanks, Avishek. It's a pleasure learning more from WHO India and partners about how hypertension is controlled there on the ground. We'd now like to go to Leanne Riley, and she is the lead for surveillance and data here at WHO for non-communicable diseases. Leanne, I'd hand the floor over to you.
Thank you very much. Thank you, Jamie. I'm just trying to, screen share, and it's not proving successful. Apologies for that.
While we're waiting for the screen share, I'd also like to remind all participants to pop any questions they have in the Q&A box on the bottom right of your screen. If you'd like to ask any of our panelists here today questions, please do add them in the Q&A panel in the bottom right. And as a reminder, we are translating simultaneously in English and Spanish. So if you've just joined us, we have over 1,000 participants with us both here on the streaming and online on YouTube and Twitter and across social media platforms. Thank you so much for joining us for World Hypertension Day. It's a pleasure to have you with us today. And today we're celebrating many achievements in hypertension. And Leanne Riley will now tell us a little bit about the hypertension fact sheets, which is a great tool for monitoring. Leanne, over to you.
Thank you. And Jamie, I hope you can actually see my screen now.
Yes.
Yes, thank you. So thank you very much. Good morning, good afternoon, good evening to colleagues around the world. As Jamie mentioned, I'd like to focus for a few moments now on one of the 4 M's. I have to confess I didn't even take in what the others are because we're so focused on the M that is monitoring. And we're very pleased to be launching a new resource today, which is a series of hypertension fact sheets that WHO has developed in collaboration with and support from the Resolve to Save Lives initiative. So these are fact sheets that have been developed now for around 80 countries who've undertaken a population-based survey in the last 10 years using the WHO STEPS methodology, where we're able to generate some indicators on hypertension. And I just want to highlight then for you some of the key components of the new fact sheets. So most importantly, we're really trying to focus on understanding what the burden and cascade is of hypertension and control. And many speakers have alluded to the importance of these indicators in their work. So the fact sheets show the number and prevalence of hypertension in the population, and then the cascade showing among those with hypertension who was aware of the hypertension before being measured in a survey, and then those who are under treatment, and of course those who are under control. I am showing you here an example for Ecuador, which is one of the countries where we were able to generate this data. The second level of information that's also shown in these fact sheets then focuses on some tracer indicators around the country's systems response. And in these cases, drawing on indicators such as the presence of policies for sodium and salt reduction, the availability of medicines to treat hypertension, and then blood pressure measurement availability in health facilities in countries. And then at the bottom of the fact sheet, we have some information around recommendations from WHO around the areas for progress towards treatment of prevention and control. Moving on to the back of the fact sheet, there's information that's then presented about the trends based on country comparable estimates over an extended period of time to just track how is that country doing in terms of population prevalence trends, and how close or off target they are to meet targets that have been set to reduce the prevalence of blood pressure. Further information is then provided about the hypertension cascade, broken down by age and sex for the relevant population in that country. And so just to summarize with a few key messages, and I think we've heard this from some of the other presentations, but here's the data to actually support it. In the 80 countries where we were able to generate these fact sheets showing this cascade, it's very clear that the majority of people who have hypertension in countries are not aware that they have it. And the awareness ranged from a very low 7% to a high of 44%. So by far, the majority of those with hypertension are unaware that they have it. We saw that only in 5 of the 65 low and middle income countries where we were able to generate this have at least half of their population who have hypertension under treatment. So there really is a large treatment gap that's illustrated by these fact sheets. And then where there is control within those people who are aware they have hypertension on medication, the control of that hypertension is also particularly low, from 2 to 32%. And again, I think we heard that in some of the presentations from previous speakers. More encouraging news is that countries are setting targets to try and address these issues, and more than half the countries where we were able to generate these fact sheets show that they have national targets for raised blood pressure to reduce it and to reduce sodium consumption. And, but worryingly, close to half the countries show an increasing trend in uncontrolled hypertension. The example that was presented in the fact sheet I was showing was that for Ecuador, it does seem to be decreasing, but close to half the countries did not have such encouraging news. So in finishing, I would just like to share with you, and we can do that in the chat as well, the link to the fact sheets, encourage you to access the fact sheets, review the data, and hopefully use it to encourage more programming and policy work in this area. Thank you very much, Jamie.
And many thanks to you, Leanne. Before we go to just a few Q&As, I'd like to first introduce Dr. Bente Mikkelsen. She is the Director of Non-Communicable Diseases here at the World Health Organization. Thank you very much for joining us, Bente, and I'll hand the floor over to you.
Thank you very much, Jamie. It's a pleasure to be here today. So happy World Hypertension Day. And I think what we heard so far is that we can no longer ignore the need for a massive scale up and investment in hypertension management. So I think we have learned it is a story about the unaware, the untreated, and the uncontrolled. So as we know, 2 out of 5 people are not aware that they have hypertension. And 4 out of 5 low and middle income countries have less than 50% of people with hypertension under treatment. And only 9 out of 10 people with hypertension do not have it under control. So I think all of the speakers has spoken to this, and we all know that this is the leading cause of deaths globally, and it is very important to control. So again, we know that today is something to celebrate. We have also learned about excellent results. So even if we have as many as 1.2, 1.1 billion people on hypertension and 745,000 million of them in low and middle income country, we know that we can do something. So as we have learned today, the WHO HEARTS technical package has been instrumental in assisting countries to implement programs to manage hypertension. And as Dr. Frieden said, it is really the pathway to universal health coverage. So we learned that countries must align and also really do this in the period of COVID. But because, as Dr. Tedros said, we have seen that COVID pandemic has been like an X-ray. So we have really seen that people living with hypertension has been more at risk of both get severely ill and dying from COVID, and also been really suffering from the disrupted health services. And we believe that by including through HEARTS and other measures, hypertension into universal health coverage, this will be the best way to build back better. So I just want to also make this opportunity to acknowledge the large number of partners who are working with WHO to make a difference. Today, you have heard from Resolve to Save Life, World Hypertension League, and the International Society of Hypertension. I also want to acknowledge the US CDC, the Global Health Advocacy Incubator, the Johns Hopkins Bloomberg School of Public Health, World Heart Federation, World Stroke Organization, International Diabetes Federation, International Society of Nephrology, and PAHO and the CDC Foundation. We cannot escape the current reality of COVID-19 affecting everything that we do. So we have to really put our acts together and learn from what we have seen today, which has actually achieved 3 million people on protocol-based treatment and with their improved control of hypertension. So let me close, Jamie, to say very much thank you to all the countries that has been part of this journey so far. And I know that many countries are now knocking on the door and really want to take the tools that we are talking about today into their own health system, and we will be supporting them to do so. Thank you so much.
Many thanks, Bente. And I do have some questions coming in from the chat. For example, I'll refer this one to Cherian Barghesi, the WHO cross-cutting head who deals with non-communicable diseases and special initiatives. Cherian, can you help answer the question? This question comes from Akshay Minhas. Does WHO think that the focus should be on diagnosis at the community level? And I'd add to that and say, should it be on diagnosis, prevention, and how do you split that, and how do you best use resources?
Thank you, Jamie, and thank you, Akshay, for a very important question. Yes, there are a large number of people with hypertension who are not detected. So detecting them is a priority, and what we say is that any interaction with a healthcare provider, blood pressure should be taken. Everyone should know their blood pressure. I think that is the way to go, and we are putting resources into that. But what is currently happening is, among people who are diagnosed, they are not getting controlled. That is something serious. That means the person has overcome the obstacles, the health system has overcome the obstacles, the person got diagnosed as hypertension, but then not getting controlled. So it cannot be sort of put in one basket alone. We have to look at the entire continuum of care, from reducing the risk factors so that we have less people with hypertension, detecting people, as you said, in the community, using different models, including through putting a blood pressure machine in the markets or in salons or many places, getting the health system ready to manage them with a standardized protocol and with access to medicines and compliance to medication, so that they are prevented from getting a heart attack or a stroke. So we have to address the whole continuum, and certainly it starts in the community, and community is very much part of that. Thank you, Jamie.
Thank you, Cherian, for that question. And I have another question actually that's just come in, and I would ask this one to Anselm Hennis, who is the regional head for non-communicable diseases. And Anselm, if you could help us answer this question, it is, sorry, I'm going to hand over the question to Arangsha Canyon. And Arangsha, are you online with the Q&A with us now?
Hello, yes, I'm here. So the question is, what skills and knowledge should primary healthcare workers cultivate to best achieve hypertension control in their patients?
Thank you so much for that very important question. I think one of the very key characteristics of a successful healthcare worker is to listen and to be empathetic. Not just that, to be well informed, to recognize that many persons coming through the clinic doors have no idea that they may have hypertension. So to be informed, to listen, to do the work diligently, to ensure that when one is, for example, checking for blood pressure, the protocols are kept in place. So the patient is made to sit in the right position, is allowed to rest before, feet in the right position, the arm at the right level, etc. So the protocols are followed, so there's accurate diagnosis. And then clearly the follow-up, the appropriate referrals, the lifestyle counseling, the health promotion. So these are all the things that need to be done so that we can really have the most informed, the best approaches, and then sustained support to ensure that the best outcomes are done. And of course, if things are not going well and they're aware of it, also highlighting the fact that appropriate medications need to be given if control is not achieved. So it really requires a holistic approach at the personal and the professional level, and continued learning. Thank you.
And many thanks to you, Anselm. And now I would really like to thank all of our speakers here today for this first part of the session. We've heard experiences from China, India. We also had with us Dominique Drogba from Côte d'Ivoire speaking on his experience of the foundation. And these shared experience can be put into action in all the countries, along with new publications launched by WHO that is sharing the experience of how over 3 million people have been better protected from hypertension and ultimately many diseases that leads to, which is one of the world's #1 killers, which is heart disease. So I'd now like to ask one final question to Didier Drogba, who's still with us, about the experience in country in Côte d'Ivoire. And more specifically, you had heart mobile clinics that were going around the country and helping to measure hypertension and manage that. What was people's response to mobile clinics, and did they understand why that was important? We can't hear you.
Can you hear me?
Yes, perfect.
Thank you. Sorry. They do understand the need of the mobile clinic, and what we offer them is the fact that it's free. So they know now that they can have access to screening. They can be screened, they can be tested, and then orientated to a better structure. So we're working with the cardiologic institute from Abidjan, and they're helping us a lot. And that's why now the population understood that this is a disease, if I may call it like that. It's a disease that can be treated. So people are not scared now to speak about it. They're not scared to say that I want to be tested. I just want to make sure that it becomes natural and nobody hides. You know, everybody should be proud to go and have a test and say, you know what, I'm healthy, or you know what, I have a problem, but I can be treated. So this is really the main objective of the Heart Mobile and the mobile clinic, is to kind of raise awareness around this cardiologic problem.
Many thanks, Didier, and thank you for that point that there's a stigma around hypertension. Actually, it could be stigmatized, but it's something very important for people to check, and it's not a stigma, and that everyone can be checked, and it's very, very easy. And with your mobile clinics, you were able to check thousands of people in Côte d'Ivoire. Thank you very much for joining us today. And actually, to end this part of the session, we'd really like to go to a video from Santa Lucia, and I'd hand it over, actually, Arangshta, if you're still with us, to introduce the video. So a little bit about the risks of hypertension and some of the risk factors: eating an unhealthy diet, being physically inactive. And one of the things that we're gonna do right now is ask all of the participants to get up, and I realize that's over 1,000 people, and so I'd like you all to stand up, because we've been sitting at our desktops and our laptops, and we really need to get a little bit of exercise and remember to move for our hearts. And so today, on World Hypertension Day, my colleague Arangshta, I'd ask you to introduce the video from Santa Lucia, who had a wonderful artist, a calypso artist, who designed this video to get people around the country dancing and moving for their hearts.
Yes, well, this is an initiative from St. Lucia Ministry of Health, that they work with a local musician in Calypso, and they created this wonderful song to promote and to engage everyone in all the lifestyles that are helping our hearts. So using the HEARTS acronym, which is the program is being implemented in St. Lucia, they created this wonderful video. It's a very short one, but as Jamie was saying, please, everyone get up and dance with the music. Go ahead.
Today, let's make a start. It's good for the heart. Somebody say, H is for health, H is for
Wow, that is a great beat, I have to say. I really enjoy that. That's a great beat from Santa Lucia Calypso artist who designed that and advocacy campaign. And I saw many of you dancing along. Thank you very much. And for the second part, I would like to hand it over to our colleagues at the Pan American Health Organization and introduce Dr. Pedro Ordunez, Regional Advisor, the Pan American Health Organization. Many thanks for joining today on World Hypertension Day. And I think that we've learned already so much from our presentations from around the world, and we are all very much looking forward to yours as well. Over to you, Pedro.
Thank you, everyone. Thank you, Jamie, for this kind introduction. Wonderful program, wonderful celebration. I think that we are ready for the second part. The second part is more dedicated to the, to introduce the new virtual course in the virtual campus public health in PAHO. Bueno, yo quiero continuar en español.
I would like to continue my presentation in Spanish.
Tenemos una audiencia
because we have a lot of representation from Latin American countries. So I would like to begin by saying that I am very happy to be here today presenting this new webinar to commemorate World Hypertension Day. This year, COVID kind of snuck up on us, and it tried to suspend or cancel our celebration for World Hypertension Day, but we snuck up on COVID ourselves. We say, we're not going to cancel it. We're just going to postpone the date, and we're still going to convene this huge audience to celebrate and draw attention to hypertension. I wanted to begin by saying that we should not forget that COVID hits people harder and makes them sicker and die if they have heart disease, if they have hypertension or some other chronic diseases. So it's always important to reiterate to wash your hands, wear your face mask, keep social distance. And this is the first message that we need to give our audience and our patients that have some kind of chronic disease. The other topic that I wanted to draw your attention to is to begin this webinar by remembering our frontline heroes that are taking care of our COVID patients and all the ones that have suffered a loss among their family or loved ones because of this terrible disease. As you know, HEARTS in the Americas has been implemented in 12 countries right now. The first cohort of countries was made up by Barbados, Chile, Colombia, and Cuba, followed then by Trinidad, Argentina, Ecuador, and Panama. And then the third cohort was made up by St. Lucia, who gave us this wonderful dancing video to kind of let loose between the first and second parts of the meeting, then also Peru, Dominican Republic, and Mexico. And we are paving the way to receive our newcomers. These 4 new countries will be Brazil, Guyana, British Virgin Islands, and Bolivia. So we are talking about 16 countries. And remember that the HEARTS perspective is to become the framework for cardiovascular treatment in the Americas by 2025. And that is what we wanted to celebrate today. We want to say, okay, let's see how much we have done so far and how much there's still to do. The Global Burden of Disease report Lancet, which was also mentioned by our colleague Sherian Varghese, also leaves us extremely concerned because once again, hypertension is once again the #1 worldwide risk factor for deaths over any other condition. But the good news is that we do have a way to face this, both with preventing hypertension as well as with treating it. That is to say, the world has enough resources to fight it. And if we pull our resources together, and if we come as one coordinated voice, our programs will achieve much more. So today, we have a top-of-the-line agenda that will begin in the second part with a presentation by Professor Norm Campbell. He's an emeritus professor at the University of Calgary, Alberta, Canada. And he's past president of the World Hypertension League. And Norm, I would say, is our consultant in chief for Heart in the Americas. And he is also a consultant for Resolve to Save Lives. Norm has been instrumental for this program. And so I wanted to begin by saying that it's an honor for me to introduce you to Professor Campbell, who will talk about the importance this topic has on World Hypertension Day, and also the new resource that we are making available to our network of countries through Hearts. And also because it will be available in the virtual realm, it will be available to all countries. So Professor Campbell, go ahead.
Professor Emeritus of the University of Calgary. He is a past president of World Hypertension League, and he's a consultant for Hearts in the American and Resolve to Save Life. Over to you, Professor Campbell. It's a pleasure to have you to say welcome.
Thank you so much. It's a great honor for me to be able to speak with you today. Many close friends, colleagues, and like-minded people. It's very exciting for me to see the progress from no public health interest in high blood pressure to some interest, some talk of action, to today where we see very rapid uptake of action in many, many countries and greater interest around the world in this topic. Now, I'm having a little bit of a hard time changing my slides. They are not moving, so just excuse me for a second while I attempt to thank you so much. And so I will move along on my presentation, which will talk more about hypertension in the Americas and the launch of a new resource to improve how blood pressure is measured. It's very important that when we talk about high blood pressure, about 95% of it relates to primary care. And it really needs to focus on the few things that are important for population prevention of cardiovascular disease. That includes screening for increased blood pressure, diagnosing hypertension in those who screen high, assessing and intervening on associated cardiovascular risks, which are present in about 90% of those with increased blood pressure, to treat them to target, and to monitor and evaluate performance. Those indicators that are in bold are all highly reliant on the accuracy of the blood pressure as it's measured. A public health approach to primary care is badly needed. It includes very simple interventions, but the interventions need to be done correctly, and especially accurately, reproducibly measuring blood pressure, and they need to be systematically applied in all of the population. Now, the speakers today have all addressed this slide very, very well, the incredibly high burden of disease associated with increased blood pressure. Some of the strongest evidence in clinical medicine is that antihypertensive treatment will reduce the disease burden. The treatment is in general very cost effective. In those at high risk, such as those with diabetes, it can be cost savings. and combined with a cardiovascular disease management program has a return on investment of about $3 for every dollar invested. We've heard that the hypertension awareness, treatment, and control rates are very low. There is a socioeconomic tier here with these parameters being better in high-income countries than middle-income countries, with low-income countries bearing a lot of the burden of disease and the lowest rates. We have good examples around the world that very high rates of hypertension control can be achieved and that they're associated with marked improvements in cardiovascular outcomes. And it's very pleasing for someone who's spent a career in this area to see that hypertension control is now a very long overdue major national and global health priority to reduce the burden of disease and stroke and to improve the productivity of the global economy. Now, this slide is looking at some of the data from Latin America and the Caribbean, and I'll look forward to updating this to 2019 now that I know the data is out today. Hypertension is the leading risk for death in Latin America and the Caribbean, attributed to about 18% of deaths, and we can see the other NCD risks close behind hypertension. Now, somewhat important to me is why do we have all this hypertension? Hunter-gatherer societies have low blood pressure, which is sustained throughout their lives. Obesity accounts for about a third of hypertension, high dietary sodium, about another third, low dietary potassium, vis-a-vis low fruits and vegetables, about 20%. And we can see that an unhealthy diet and an unhealthy diet environment where we all live accounts for perhaps 81% of hypertension. Now, these specific risks are highly dependent on the country and where these different risks are, what levels in the specific country. Now, if we look at the treatment of hypertension and heart disease and stroke, again, this is some of the strongest evidence that exists in clinical medicine. A 10-millimeter reduction in systolic blood pressure, which is about one drug, reduces the chance of stroke by about 3 in 10, heart failure by about 3 in 10, coronary heart disease by about 1 in 5, and premature death by about 1 in 7. You've seen this slide. This is a slide from Resolve to Save Lives that really looks at the sad situation in the world with about 1.4 billion people with raised blood pressure, only half aware, many of those not treated, and many of those treated not controlled, so that fewer than 1 in 7 with hypertension worldwide have blood pressure under control. And I think Dr. Riley's presentation, it may be even lower than that. As a result, the World Health Assembly developed voluntary targets to reduce non-communicable disease 25%. One of the key ones was to reduce raised blood pressure 25%. Global best practices, the HEARTS program, a technical package created under the lead of the World Health Organization. Resolve to Save Lives, a major implementing partner of the HEARTS program. Kaiser Permanente in Northern California, really the foundation of many of the interventions in HEARTS, was able to achieve control rates of 90%, something that's been replicated in some of the programs off the Americas. The PAHO HEARTS in the Americas program, which has demonstrated a very successful implementation with improved hypertension control. It can be achieved in other areas of the world, as we heard today. Yaroslavl, Russia, shortly after 2010, introduced an education program which over 4 years doubled the control rates and was associated with a reduction in stroke. Canada, I'm very proud to say, remains a world leader in controlling hypertension with control rates around 60%, but have been as high as 68%. And I'll point out a Sao Paulo call to action from the World Hypertension League and partners, which really tried to outline what non-governmental organization could do to support the implementation of the HEARTS program. But very importantly, HEARTS and its related programs are designed to be more effective in hypertension control, more efficient with your resources, and more cost effective. This is the heart's modules, which I will not go through, but you've seen healthy lifestyle counseling, simple, directive, evidence-based treatment protocols, access to medicines and technology. And for the next part of my talk, this will focus on accurate blood pressure monitors, risk-based charts, team-based care, systems for monitoring, and a good implementation guide as to how to progress. Now, as we move towards blood pressure measurement, this slide illustrates some of the problems with an accurate, reproducible assessment of a basal blood pressure. In the chart, you're looking at an interarterial monitor of the blood pressure of a normal intensive person. What you can see is the physiologic changes which relate to psychological and physical stresses during the day, such that there's more than a twofold change in systolic and diastolic blood pressure at different times. So how we deal with this is by using accurate or different methods of trying to standardize the approach to blood pressure measurement. This is greatly aided by a document from the World Health Organization released this year, which relates to the technical specifications for automated non-invasive blood pressure monitoring devices with a cuff, and really focuses on upper arm cuffs. The WHO document, and indeed the different steps to obtaining an accurate, reproducible basal blood pressure includes pressure monitor, standardized preparation of the patient, a quiet, comfortable environment, and the use of a highly standardized blood pressure assessment technique. The latter three bullet points really relate to how one removes the variability in blood pressure associated with psychological and physical stressors. Now, when we audit clinical practice, this is from a study done in Canada, but it's been replicated around the world. In this particular study, it examined 200 primary care physicians and the percentage that followed different recommended techniques. Within the study, exactly 0 people followed all the recommended techniques. And this slide shows that for several of the techniques, they were rarely followed. Now, what this does in terms of assessing blood pressure has also been audited. And in one study, again, a Canadian study, 57% of the patients had a change in their blood pressure classification from normotensive to hypertensive or hypertensive to normotensive when a usual clinician measured the blood pressure versus a highly standardized approach. Most of the blood pressure errors were in a false classification of hypertension relative to normal tension. Now, this slide, I don't intend for people to read, but it's just the impact on blood pressure of different parameters of not standardizing patient preparation or not following standardized procedures for blood pressure measurement. And they're additive. And what you can see is a significant variation in blood pressure when standardized methodology is not used. This slide just looks at a population distribution of blood pressure. This is from an American study, and it looks at the impact of 5-millimeter error in the number of people with hypertension. And what you can see is that if the blood pressure is systematically measured too low, this cuts the number of hypertensive patients almost in half. And if the blood pressure is systematically measured 5 millimeters too high, it approximately doubles the number of hypertensive patients perceived. Very similar would be a 10-millimeter systolic blood pressure error. Now, I'm very pleased and indeed honored to be part of the Hearts in the Americas program, a highly functional program under the lead of Dr. Pedro Ordunez, who's really driven this program to success. Even before the release of the WHO devices report, a scan of government policies related to the use of accuracy validated automated manometers was conducted and revealed that there were very few, and what policies there were fragmented related to these devices. One can assume, and in fact I know the situation is similar in other regions of the world. Related to this, the Hearts in the Americas meeting, March 2020, in part focused on the WHO technical specifications report. Immediately, country representatives from several countries indicated they could very quickly change government procurement policies to align with the WHO report. Cuba, in fact, preceding the release of the report, had already developed a facility and a team to assess the validity of automated monitors and was working with its industry to align their devices. In collaboration with the Menzies Institute in Tasmania, Australia, PAHO worked to develop a new online resource that would aid countries, healthcare professionals identify validated devices which they could purchase. The next talk will focus on this brief online training and certification course. It'll be available in Spanish, Portuguese, and English, and in fact is already up. It was produced by the Pan American Health Organization with the World Hypertension League, Resolve to Save Lives, the Lancet Commission Group on Hypertension, and Hypertension Canada. We plan to make this available in other languages shortly, French, Chinese, and Italian, and it may well be available for people who are interested to translate into other languages. So in terms of solutions to measuring accurate blood pressure, examining and implementing the key recommendations from the WHO devices report, relating to procurement of devices, regulations regarding marketing of devices that have not been validated, and developing facilities and training for people to certify them in blood pressure measurement are key steps. Other steps not addressed in this talk where resources are available include the use of out-of-office blood pressures in the community, home, and if available, ambulatory blood pressures. I think very, very important is the Pan American Health Organization and World Health Organization sustaining its assistance to countries to implement policies relating to accurate blood pressure devices and training and certification of those who measure blood pressure in patients. Now, it's a great pleasure for me to have the next talk presented by the real creative genius behind this program. And I thank you all for listening to my presentation. Here's a picture of my environment, which is conducive to low blood pressure.
Bueno, magnífica presentación, Professor Campbell.
Excellent presentation, Professor Campbell, as usual. So inspiring. And above all, it is a combination, because when Professor Campbell speaks, he tells us how poor the situation is. He tells us how serious the situation is. But what's important is that at the end of his talk, we always see the light at the end of the tunnel, and you say, okay, there are tons of solutions within our reach. And possibly if we were using those solutions that we have today, which are right there within our reach, and which require cooperation and systematic effort, I'm sure that the situation would probably be better. Because if we see the panorama of non-communicable diseases today, where we'd most advance in the least amount of time are with the cardiovascular diseases, because of the size of the problem, of course, but also because there are certain risk factors like the hypertension, which definitely can be mitigated and definitely can be controlled. One of the greatest emphasis that Hearts has placed on this is the first level of care, primary care. And I think that this is something we can't emphasize enough. If there's one place where the health teams must be prepared to respond to these chronic diseases, especially cardiovascular diseases and hypertension and diabetes, is at the level of primary health care. If we have a strong primary health care with the right teams, with the trained staff, with the appropriate medications and the necessary equipment, we can advance considerably in a short period of time. I want to invite you to make note of this somewhere on your desk, on your computer, and find the word Hearts in the Americas. Look for the word Hearts in the Americas website. And in the Hearts in the Americas website, you'll find an important and valuable group of resources, including these we're talking about here. At the end of today, we're going to consider other courses in the virtual public health campus. But today and right now, I have the privilege of introducing a very talented person. Professor Campbell, in fact, defined him as a genius in the field of medicine and art. This is Dr. Tej Khalsa. Tej comes from the Mayo Clinic in Rochester, Minnesota.
Where she is assistant professor with a great expertise in knowledge translation, and she is one of our collaborator and our consultant. Please enjoy, this wonderful video. The video will be available in the Hearts in the America webpage, and also in our website in the virtual campus of public health of PAHO. Dear Tech, over to you, please.
Thank you, Pedro, Dr. Ordonez. That's a very kind introduction. I hope everyone can hear me. And I'm going to try and share my slides with you. Pardon me for just a moment. Sorry about the delay here. I'm having some technical difficulties.
Hi, Tech, this is Jenny. We received your presentations. We're trying to upload it in the system.
Okay, thank you. I'm going to try again here.
I think in the meanwhile, we should try to answer some questions, Dr. Pedro. What do you think?
Sí, correcto, claro que sí. Yo estaba diciendo que...
Yes, that's wonderful. That's a good idea. I was saying that this happens on television as well. We're not the only ones with technical problems. We're trying to do everything right, but with this question of technology and COVID, look how wonderful. We're connected with so many different parts of the world, and we're trying to have a webinar like this. And I'm being asked, actually, I have a question here for Dr. Campbell. Professor Campbell, what's happened after the convocation of the World Hypertension League and others in Sao Paulo with the question of the blood pressure there? Do you think that we're giving it more importance now at a world level? How do you see it, sir?
Pedro, when I started my career, there was no public health interest whatsoever in raised blood pressure. And it's been a very gradual evolution. But I am so heartened by this particular session where we've really rapidly transitioned from talking about it, developing tools, to really seeing the uptake of tools that are really benefiting millions of people, and seeing other countries and groups joining the effort. So I see we're in the very rapid exponential phase of achieving success. something I never thought I'd see in my career. So I'm incredibly heartened. And Pedro and the Pan American Health Organization, I think you've been very critical to this. Good leadership from the WHO, resolve to save lives. I think the active ingredients for success are all there.
Muy bien, muchísimas gracias. Creo que ahora sí estamos listos.
Very well, thank you very much. I think we're ready now. I think we are ready to get started with Dr. Khalsa's presentation. So with no further ado, I'm going to introduce Dr. Tej, who's going to talk to us about virtual course on accurate measurement of blood pressure.
Thank you, everyone, for joining us today for the launch of this virtual course on accurate automated blood pressure measurement. Like Dr. Ordonez said, I am Dr. Tej Khalsa. I'm a general internist at the Mayo Clinic. I also have expertise in knowledge translation, and I've been honored to partner with PAHO and an exceptional team that they put together for the expressed purpose of launching this new free virtual course on how to properly measure blood pressure. And in introducing this course to you, I'd actually like you to step back for a minute and reimagine it instead. Reimagine the accurate assessment of blood pressure as a story. You know, we're telling a story today on World Hypertension Day on how we can save lives. And part of our plan is to do this through the launch of this course in teaching people how to properly measure blood pressure. And the course itself has a backstory that I'd also like to take a moment to share with you before we begin. And take you behind the scenes. 2020, as everyone has noted, has been an unprecedented year on many levels, and it's impacted all of us. It's impacted the people we are closest to. At the same time, I have to tell you, I've been incredibly heartened, pardon the pun, by the spirit of collaboration I've witnessed rising up around me, and working with PAHO to create this course has been a beautiful example of the power of collaboration. To create this course, PAHO reached out to global hypertension experts and global and national health officials. And despite the unique stressors facing many at Resolve to Save Lives, the WHO, at PAHO, at the Lancet Hypertension Commission Group, at Hypertension Canada, people still came together generously, sharing their time and their expertise to create the best possible virtual training program on blood pressure measurement. And being able to partner with PAHO on this course has filled me with hope. Working with PAHO and our team of experts, it's been inspiring. Even in the weeks prior to this course launch today, our team has been continuing to have conversations on how we can build and improve on the success of this course for future years. We've been discussing how we can continue to expand the reach of this course to serve as many nations and communities as possible. In what can feel like a polarized world at times, to see PAHO and its partners continuing to rise and lead in a spirit of collaboration for the greater good of improving global health and the control of hypertension, it's nothing short of inspiring. And why am I talking about our experience behind the scenes for so long? I know we all believe that successful relationships lead to successful results. And I hope the care and commitment that our entire team put into this course translates into a more joyful and meaningful experience for anyone who completes this training. And with that, let's begin and let's take a look at what's waiting here for you with this course. The course itself is quite simple. There's essentially two core components. There's a training video that takes about 12 minutes, give or take, depending on the language you view it in. And then there's just a quiz that you take afterwards. That's it. Just 2 core components. The entire course only takes about 20 minutes. You'll see these orange materials here in the center. They're simply supplemental files available to download, and they reinforce the material covered in the video, and they provide extra preparation if needed for the quiz. These are easy to download files, and they should hopefully keep the course user-friendly so that even if a trainee is in an area with patchy internet connection and the high-res video isn't loading for them, they can hopefully still download these written materials that include most of the illustrations from the video, and they're still set up for success. The course video, which you'll see at the end of this presentation, we'll see a short clip of it. It has been adapted for English, Spanish, Portuguese, and French. And I know some of these different iterations will be rolling out later this year, like the French. And the course quiz, it's a true or false knowledge test. You do have to get all the answers right in order to earn the course certificate. And if you're like me and you get nervous about having to get 100% on anything like this quiz, fear not. We have some reassurance here for you in the form of this Q&A module, which provides teaching around each of the questions covered in the quiz. All of these materials, we hope, will help everyone who enrolls feel like they can move through the course smoothly, supported, and set up for success. Once the quiz has been completed, participants will obtain a course certificate that looks something like this. One key takeaway about this certificate that's important to note is that it's only good for about 6 months from the time the course is completed successfully. And this has been done intentionally given the data that suggests that regular training every 6 months is necessary to ensure accurate blood pressure measurement and skills. That includes regular retraining, not just for people like me, doctors in primary healthcare settings, but it also includes large-scale screening programs or other population-based blood pressure programs. We all need retraining. We all need recertification every 6 months. It's our hope that this training program will be well received. PAHO official, Dr. Rodriguez, and myself, just to be certain or hopeful, did conduct an informal pilot study of sorts of the video using a convenient sample of recruits within our households. I'd love to show you the results here of Sarah, Dr. Rodriguez's beautiful daughter, beautiful and smart daughter, watching the course video. Let's see if this works here.
We could get inaccurate, misleading readings. Inaccurate or misleading readings don't help anyone. Inaccurate or misleading readings can lead us down the wrong path. It can cause us to miss people that actually need treatment, or to give treatment to the wrong people, or give too much treatment to people. Sadly, this happens a lot. A lot of people measure blood.
And so, Dr. Rodriguez and I made inferences from our children's eye movements and body language to conclude that if the course video can mesmerize and almost sort of immobilize our toddlers, then it probably passes our minimal viability standards for launch day on World Hypertension Day. But in all seriousness, the course is presently not intended for this target audience. It will be one day. Instead, the course is intended for healthcare personnel, including non-professional healthcare workers, particularly at the primary healthcare level, The course is also suited to health science students and health literate people who measure blood pressure at home or who are involved in a program that assesses blood pressure. The course video tells the story of a person. And again, I want to encourage you to reimagine everything we're talking about today on World Hypertension Day is really PAHO and the WHO telling us a story. And it's a story on how we can save lives. In this course video, there's a story being told of a person, a curious individual here who learns about the global significance of hypertension as the greatest single risk for mortality globally. And then we follow this curious person as they learn how to properly measure blood pressure and they become empowered to save lives. The course itself also centers on a single great tree with 5 branches. This great tree represents all the knowledge and research that has given rise to our understanding of blood pressure and its accurate assessment. Each limb or branch makes up one of the 5 steps to properly measuring blood pressure. This tree is yet another example of how we've tried to create a story for you. It functions as a way of organizing and unifying all the information on accurate blood pressure measurement. In all honesty, back when I was a medical student, it often felt like there was this complex constellation of different variables that make up blood pressure measurement. And students like me would have a list of these different factors, and we would have to force ourselves to memorize this list. Instead, in this course, knowing that as humans, we are biophilic, we all love trees, we've tried to present the information in a way that's relatable and memorable through this cartoon tree. There's also another story being told here. If you can kind of see that if you stray away from the tree, if you stray away from properly measuring blood pressure, you will get lost. You turn your back on people. You can see there's a little crowd of people there. You'll turn your back on people who really need your help, and you risk falling into a deep, dark rut. You know, the sad situation we find ourselves in. Here's my son learning about what happens when we don't measure blood pressure correctly. You can see there's a little tear there underneath his eye, but he's also smiling. I like to think he's smiling because he knows that there's a different path we can all take. We can all instead gather around the great tree and learn how to properly measure blood pressure. And so now let's talk about the 5 major components of the course. Step 1 really does focus on selecting a validated automated device. This is really a core essential piece in accurately measuring blood pressure. And this is a core step that's evidence-based, and I've cited some of including the WHO report that we've already discussed that really reinforces this call to action around prioritizing automated devices in blood pressure measurement around the world. Step 2 focuses on selecting the right cuff size. You know, that can sound like a simple step. Why give it one whole branch of the tree? But Dr. Norm Campbell did previously cite a study from Canada which suggests that only 1% of physicians use the right cuff size when measuring blood pressure. And so this has been given special emphasis in the course as one of the essential 5 steps. We've also tried to, even though the course, of course, doesn't have someone like myself or a PAHO official in front of you, talking to you, demonstrating everything, we have tried to give you illuminating visuals that make it clear how to use the markers on a cuff, to properly position the cuff on a patient and know if you have a good fit. We've also tried to give very extreme examples here of what it looks like when you don't have the right cuff. Step 3 is really around preparing the person for blood pressure measurement. And again, you know, when I was a medical student, it felt like there was just this long list of disparate, you know, different variables to measuring blood pressure. And it was hard to put them all together, hopefully by organizing them within this tree, but also the visuals that we have. The visuals alone hopefully can help people during that 6-month span be able to go back and remember what pain and anxiety and stress look like, what smoking, how smoking is significant and really can't be happening at the time of blood pressure measurement. People can't be chewing tobacco, drinking coffee or tea. People also shouldn't be in an environment that's too hot or too cold, and they need to be off social media. They need to be off of their phone while they're having their blood pressure measured, and that we need to all be sitting quietly and peacefully and comfortably. We've also tried to outline the correct positioning of the person having their blood pressure measured here. This is sort of a crude cartoon, but it's to outline how the center of the cuff needs to be aligned with the center of the heart, and a person needs to be there for position so that can be possible, even if that means a pillow. They need to also have, of course, back support, a bare arm or a shirt with a very thin sleeve. Their feet need to be flat on the floor, and they need to be waiting a whole 5 minutes and not be talking during that time. The person doing the measurement can't be talking, and the person having their blood pressure assessed should not be talking. We also talk in branch 4 or step 4 about how to measure the blood pressure, certainly with an automated device. That's as simple as turning the device on. But we do try, for those who use semi-automated devices, to give a very brief overview of the core components of what's involved in taking the pulse and inflating to a point where you can no longer feel the pulse. And we also emphasize the number of blood pressure measurements that need to be taken when assessing the blood pressure, that ideally on at least one visit, we need to be assessing both arms need to be assessed on at least one visit, like the first visit. And then the arm that has the higher readings, we want 3 values, ideally multiple readings from the arm that has the higher readings. We also make a caveat in the video where we acknowledge that there are certain clinical situations, such as in people with atrial fibrillation, where these recommendations may not necessarily fit, and that a different approach may be needed. And then finally, we go through what needs to be recorded, what needs to be documented when assessing a person's blood pressure. And I would love to now invite you to watch the last little bit of the video where we summarize the steps involved in properly measuring blood pressure. And I'll ask PAHO to kindly show us that little segment so you can get a flavor of what's waiting for you with this course video. Thank you very much. Now that you've reviewed this video, let's summarize the steps involved in properly measuring blood pressure. 5 steps to properly measuring blood pressure. Step 1. Select a validated automated device. Visit this website to find devices that have passed international standards. Step 2. Select the right cuff size. Most of the time, you will be choosing between small, medium, and large cuffs. When wrapping the cuff around a person, you must use the markers on the cuff to help you decide if the cuff is a good fit. Step 3. Prepare the person for blood pressure measurement. Remember that people who are anxious, stressed, or in pain will have falsely high blood pressure. You will need to repeat their blood pressure at a different time when they are calm and pain-free. The person should not smoke before a blood pressure reading. The person should be sitting comfortably in a comfortable, quiet environment. Their back should be supported and both feet should be flat on the floor. The arms should be bare and supported with the blood pressure cuff at the level of the heart. The artery marking on the cuff should be placed on the inside of the arm in alignment with the brachial artery. The cuff should be wrapped so that it is not too tight and not too loose, but with just enough space to slide 2 fingers underneath it. Step 4. Measure the blood pressure. There should be no talking while the blood pressure is being measured. You will need to inflate the cuff by squeezing the bulb on the semi-automated devices. Stop inflating when you can no longer feel the pulse. You will need to take a total of 4 measurements, 1 in each arm and 3 in the arm with the highest pressures. Make sure to write the numbers down each time so that you don't forget them. Step 5. Record your results. You'll take an average of the final 2 readings and also note the arm used, cuff size, heart rate, age, gender, and use of any antihypertensive drugs. Congratulations! Now you're ready to measure a person's blood pressure.
Tech, por favor, ¿quieres comentar alguna cosa finalmente en tu presentación?
Tech, anything else that you would like to say before concluding your presentation?
Thanks, Dr. Ordonez. I just want to say that I am reviewing some of the comments coming up in the chat. Thank you for the kind feedback. I also am taking note of some helpful recommendations for next time in terms of things we consider reinforcing and teaching around, and we will certainly take that into consideration because, like I said, this is an ongoing initiative and we are all very, very keen to help support all our partners in creating and revising to have sort of a living course that is really the best reflection of what we all agree on in accurate blood pressure measurement. Thank you so much, Dr. Ordonez.
Bueno, excelente. Yo creo que
Very well then. I have enjoyed this wonderful, inspiring video. When I watched it for the first time, I said I could not imagine that someone that was offered to me in such complicated manner could be simplified in such an easy way. But this effort is part of a much larger effort that we have been making for a while through Hearts in the Americas. And that's why on the Hearts website, and once again, if you type on your browser Hearts in the Americas or Hearts en las Américas, depending on the language, you will find all the virtual courses that are available. And let me tell you something before we move on to our next presenter. Hearts virtual courses include over 500,000 subscribers. I'm sorry, 250,000, 250,000 subscribers approximately that have already registered for Hearts courses. The majority of them have to do with primary health care. So this means that we are making a significant effort in order for our health care teams. I'm not talking about the doctors, I'm talking about primary healthcare teams, giving them all the tools, because not only do we work through the doctors, but we also work through the nurses, nurse practitioners, healthcare workers, pharmacists, psychologists that work at healthcare centers, etc. So it is very important, again, for the PHC team to be able to do so. And hopefully we'll be able to teach our patients how to self-monitor their blood pressure at home. So once again, in our PAHO virtual courses, we have almost 250,000 subscribers. And a week ago, I don't know, a couple weeks ago, we launched the new refresher course for blood pressure management, which was also produced by our public health virtual campus, and now we're launching this new course. But Dr. Tech was saying behind this, there are a lot of people behind the scenes. I love the way she said it, because I think this is also the time to acknowledge the work of our colleague Jenny Rodriguez, who is coordinating all of these virtual campus courses and is currently working on a series of new courses that we will present to you in due time. And also some other people, such as Carlos Leon. Carlos Leon is a staff member from the public health virtual campus at PAHO that does magic with slides, audio, presentations via speakers in order to be able to upload those videos to the website for you to use. So it is now a pleasure for me to introduce Mr. Carlos Leon from Panama, who will help us navigate in this PAHO Virtual Health Campus website and see how we can find the course that we are launching today. So Carlos, go ahead, please. Good morning, everyone, and thank you, Dr. Pedro Ordóñez, for your kind introduction. And it's an honor and a privilege for us to be able to address how to access this virtual campus to take these courses. I hope you can see my screen properly. I am sharing my screen to show you my these slides. And let me begin by thanking the entire team that has coordinated this webinar, all the panelists, and everyone that worked so much in these courses behind the scenes. And by the way, all of these presentations were made with a lot of love and dedication so that you can have them available during this course that Dr. Tech described brilliantly. And she gave you an overview of the different steps in the video that you can expect to find in the course. So I'm going to teach you how to navigate the PAHO WHO Public Health Virtual Campus. I'm not going to talk a lot about the course because Dr. Tech already talked about this, but I would like to show you what the virtual campus looks like and how to navigate it. I understand that we have over 1,000 participants that have joined this webinar, and I'm assuming several of you have already logged onto the virtual campus. This is the website. It's www.campusvirtualsp.org for the Spanish version. And with this, you get to PAHO's virtual campus in Spanish, and to up on the right, you can log in or create an account. So first you create an account, and once you create an account, you can log in. And if you have an existing account, of course, you can just go to login. And then you can go to the self-learning courses that are here to the right. And so you can see these courses that are free of charge. You can take them at your own pace. You can, for example, register today and watch part of the video or part of the modules. And then tomorrow you can move on to the next module, and maybe next week or the week after that I can complete the course. So you can complete the course in one day, over several days, or however long you need according to your availability. So these are the self-learning courses. So this is the English portal because, like we said, this blood pressure course for the time being is available in English only. So in that case, you have to look for this picture, this pretty image that was created by our graphic design team, and that's how you can access the course. And once you do, you can watch the video that Dr. Tech described and then take the quiz. And like you said, there's several questions, true or false. And you can also get feedback or some kind of explanation for each question and answer. And once you pass the quiz, you can download this the certificate. And like Dr. Tech and Dr. Jenny Rodriguez said, This certificate is good for 6 months from the time it was issued, and then you can retake the class and download the certificate once again. On PAHO's website, Virtual Campus, there's over 1 million users taking the different courses, all these self-learning courses, and like Dr. Ordunez said, for the mental health and ENT, and specifically the courses related to hypertension and the ones related to hearts and chronic kidney disease are the most widely visited or most popular ones. So apparently people are very interested in these. Okay, so I'm still sharing my screen. Like we said, this virtual course on accurate automated blood pressure measurement is available in English only, but in the upcoming weeks, it will be made available in English, Spanish, in Spanish, French, and Portuguese as well. So it's very important to have the course in different languages. And something else that Dr. Ordunez mentioned and Dr. Jenny Rodriguez said is that there's this update course on hypertension management and cardiovascular risk in primary healthcare. This is a course that was released not long ago during a webinar on September 29th of this year during Heart World Day. So in this course, you will be able to find academic up-to-date information following the HEART's guidelines and also the world guidelines for hypertension management and cardiovascular risk. So this is another course that's available on the website, and you can also take it. Okay, so that's it for the PAHO's virtual campus. This is all from the technical team. Thank you for giving us the time to teach you how to find the course. And here you have the website for our help desk and this email address that you can write to if you would like to contact us or if you have any users, any problems with your username, password, etc. Thank you.
Excellent, Carlos. Thank you so much for all that information, which complements the whole effort of so many people and so many partners. I want to take advantage of this moment to acknowledge our historical panelists who've been with us in technical support and financial and all this effort. In the first place, I'd like to acknowledge our colleagues from the CDC who have been there supporting us with their technical resources and financially. And it's thanks to their effort that we've been able to strengthen the instruments and materials we have in the virtual campus, the public health virtual campus. For example, this course, which we're presenting here, has also had the support of our partners. And I also want to express a special gratitude to our partners from Resolve to Save Lives for their technical and financial support in the development and progress of Hearts in the Americas. And of course, I can't forget our colleagues from the WHO, in particular, Cherian Vargas, for his continuous and timely cooperation, support, and counseling to launch Hearts in the Americas in the right way and to always be aware of our progress and our everyday work. Also, I want to take advantage of this opportunity because it's a wonderful opportunity on this World Hypertension Day to reiterate what we've done in other webinars. Hearts in the Americas and the NCD control and preventable programs have suffered the impact of COVID-19. They've suffered the impact in the follow-up of the disease, of the patients, and the scarcity of medications in many places, and the impact of the effect on the health personnel. What we're saying is that the patients with chronic non-communicable diseases, as well as those who suffer from hypertension or diabetes, are in the target line of COVID, and we can't let go. This is a time when we have to introduce hearts in the Americas, and that's one of our slogans, which is called Building Back Better with Hearts in the Americas, trying to reproduce, to be aligned with the policies of rebuilding back better health services with more innovative approaches, with more inclusive approaches, so that those who require care or services can get it in the best quality, the best way possible and with the best quality. And it requires a strategic movement, which is to strengthen the first level of care in the diagnosis and treatment of blood pressure, as well as the prevention of cardiovascular diseases. We're coming to the end of our webinar this morning. I know that we have many professors from universities online, as well as many of our partners from the scientific societies in the region, as well as in the world. And I'd like to launch an idea. There's a lot of material, first-class material in the Public Health Virtual Campus, as well as those prepared by WHO and other partners. The one Resolve is presenting, the World Hypertension League. I ask all of your universities to take ownership of these courses. These are all free, and use these courses in your universities to contribute to the education of your students, your medical students, your nursing students, your pharmacy students, training of all the health who are not necessarily medical professionals, all the health workers. We have a tremendous amount of resources. What we have to do now is to make the best use of these. And I'm so happy to see two authorities such as the World Hypertension League and the International Society of Hypertension with us today. And that's another effort that we're doing with the World Heart Federation. I believe that the core of all this must be placed always at the first level of care. We're not going to advance neither sustainably or substantively or strategically if we don't do it at the first level of care. And we have to realize that when, at the beginning of our conversation, the Director General of WHO asked us to pay attention to the problem of hypertension, and Dr. Friedland asked us to consider hypertension and these programs as a way to evaluate universal health care. I want you to think of this, to stop and analyze it. Try to talk amongst yourselves with your leaders and convince them then to work and invest in hypertension is a cost-effective way to reduce the burden associated to these diseases and have a better health situation. I also want to take advantage to end to thank our administrative staff who's behind all this, our colleagues from WHO, the PAHO communications and WHO communications departments, as well as the technicians who make these platforms work, our interpreters, all our first level speakers we had today, and at this point of the webinar, which began at 9 this morning, we have close to 1,200 participants online. Just in the Zoom room, without even counting on the other platforms that are transmitting this. There's another question on the chat that asks how we can guarantee that these presentations will be available. I can tell you something if you don't know. In the HEARTS website, each one of our webinars, each one of our programs is uploaded. You have the slides of all the presenters. These are openly available, and you have the whole session recorded. So today we have the whole session recorded from the very beginning. You can see the session in Hearts in the Americas. If you weren't able to come, if you want to share it with your colleagues, if you want to suggest it to others, now that we're in the times of the associated media, let's take advantage of these opportunities. And we don't want any more fake news or stuff like that. Tweet it now. Tell them we're here. We're concluding this webinar of Hearts in the Americas. It's the World Hypertension Day. It's work with WHO, with PAHO, Resolve to Save Lives. And all of us are trying to create the necessary conditions for us to have a community of practice. What we learned from Trinidad and Tobago, what we learned from India, what they're doing in Hearts worldwide, and what we're doing with the hypertension programs is all highly relevant to help the countries that are already implementing these initiatives at a greater speed, so that COVID is not a justification, but an incentive to help us change the way in which we deliver the health services. After COVID, if we get out as we started, we're going to fail. That's obvious. We have to get out of COVID with new services, with greater innovations, in a better position to do things simpler, better, and a strengthened level of care. I want to congratulate you all. I want to take advantage to thank you for your time, your patience. It's been a long session. We still have a few questions and we have time to answer a few of them. So I'd like to ask my colleagues who are on the chat, Jenny Rodriguez, if she has any questions, or Arancha Cayon, who's also checking the questions, if they have any questions for our speakers before we conclude. Jenny, you have the floor. Jenny, Arancha, you have questions? Yes, I'm here. Some of the questions we have come from Peru and Chile, saying, what do we do for the certificate to be recognized academically by the academic entities of the different countries? I want to take advantage to tell you that the virtual campus has certified with academic hours, often recognized by the medical schools, by the scientific schools of the different countries. In fact, we have been working with the different countries to get them to recognize these certificates automatically so that they don't require any necessary conversion. Another question we have here, I want to clarify again, is that yes, it is necessary to enroll in the virtual campus. You have to create an account, you have the user account and a password, and then enroll in the course you want to take. Basically, those were the two questions that I had. Thank you. Oh, I have one more, if I may, Pedro. I believe that it may be interesting for the public in general. Yes, please. The question is whether it would be recommendable to use digital equipment to take the blood pressure, to measure the blood pressure. Absolutely, absolutely. I think that we were very clear in that. There are automatic and semi-automatic equipments that are validated, and that's the correct word. These have been validated. If you go, Arancha, to the PAHO webpage, he corrects, to the Hearts webpage, it's a joint effort with the Tasmania University, led by Professor Chapman, Yane Chapman, and a group of world experts. We just published a resource of the websites to identify the right validated manometers. I know that there's a lot of problem with this, and in fact, those of you who want to buy a validated manometer don't always know how to do it. So there's no specific recommendation saying what brand or what equipment you should buy. What we're recommending is the characteristics that the manometer should have, how you can identify whether they're validated or not. Also, there's a list of resources published so that you can find the equipment, as well as a couple of articles, papers defining how to identify the manometers. But if we're talking about manometers, validated manometers. They can be automatic manometers, and that's one of the key things of this new movement. Arancha, you have another question? Jenny, Arancha, you have any other questions? No, we really don't have any more questions. Okay, then, once again, our gratitude to our team of Hearts in the Americas, the administrative team, the technical experts who are working, Jenny, Cynthia, Gloria, these are all working in the back. Jenny from WHO for the first session, chairing the first panel, and all of you who participated in one way or another. I hope this has been an important day for all of you and that you enjoyed it and taken advantage of this important resource in your training. And we'll see you in the next webinar, which will be very soon. Soon, we will be announcing the next webinar. It will be one that will be dedicated to a topic that is indispensable as well. Cardiovascular diseases and hypertension during COVID. And the main speaker will be Dr. Petty, who will be with us for a few days as well. So pay attention to our next webinar, and we hope to have you all with us, with new partners and new colleagues. We'll see you the next time. Thank you very much. Again, thanks to our interpreters for making this tremendous effort. I want to acknowledge all of you. I want to acknowledge the administrative teams, our gratitude to all of them, and all the panelists. We've even had a star football player with us. So you can imagine, this has been a great session. See you the next time. And I hope you can all turn your cameras on and see who's there and say hello to each other. Turn on your cameras and say goodbye. I see Hennis, Gloria, Iliani, Cynthia, Sherian. Who else is there? Sherian is there. Xinhua. Great. Greetings to all of you. Who's going to take the picture of everyone with the cameras on? Cynthia, you're going to take the photo of all our panelists so that we can have this as a memoir. And you can have the presentations, the recorded webinar. I'm almost like I don't want to finish this. I am going to wave goodbye and good luck to all of you. Take care of hypertension and take care of COVID. Use your masks, wash your hands, maintain physical distance, not social, physical distance. Maintain the physical distance. Okay, thank you all very much.
Thanks so much, Pedro.